Hi all, I am Dr. Manoj Ayyappath. I am a specialist in surgical gastroenterology. I am a surgeon who operates on intestinal problems. Welcome to my YouTube channel. Today I am going to discuss with you a few points about incisional hernia. It's a variety of hernia. What exactly is an incisional hernia? The incisional hernia is a hernia which happens in a previous operated patient. So what is an hernia? Hernia is a protrusion of your intestine or fat or part of your bowel through a hole in your abdominal muscle. In incisional hernia, the bowel or the hernia comes out through a defect, weakness in your previous incision site, that is a cut site of your surgical site, previous surgical site. So how does it present? A patient who has undergone a surgery previously suddenly started noticing a small swelling at the site of his previous surgery. He'll have some small pain there, a little pain, and after some time patient noticed that the swelling starts increasing in size, and later on it may produce pain. So that is what an incisional hernia is, and it can be precipitated by a patient who is doing lot of heavy work or exercise or goes to gym. In such patients can have an incisional hernia at previous site. So what you should do when you see such a hernia, so once you see such a hernia or a swelling there in your tummy, you should go and meet a surgeon. So he will do a clinical examination. He will touch and see whether it is going inside or not. Then he will tell you whether you got an incisional hernia or not. Why do you go to a surgeon? Because it can produce complications. What are the complications of incisional hernia? It can produce irreducibility and obstruction. What is irreducibility? Generally, when the patient lies down, this hernia goes inside. So if it is not going inside, it is irreducibility. What is obstruction? Sometimes the intestine which comes out through this hernia will get blocked by the hole. In such cases, the patient starts having pain and vomiting. Whatever he eats starts getting vomited. So that is what obstruction is. So these two are the complications. So once this complication occurs, the patient will have severe pain, start having vomiting, suddenly the tummy starts coming distended. So the abdominal distension will happen, will not pass motion. So such problems can have fever also. So such are the complications. So once you meet the surgeon, he will examine and tell you there is incisional hernia. In such cases, you have to undergo surgery. And what surgery? You can have two surgeries, either an open surgery or a keyhole surgery. Open surgery, he will make a cut in the previous site, or he will cut open the hernia and he will push the intestine inside and keep a mesh and close the defect and close the hole and keep a mesh. Or else you can go for keyhole surgery, in which the surgeon goes inside, take out all the intestine inside, then keep a mesh inside. That is a very good surgery for incisional hernias. It is painless. In 2-3 days you can go back to work. But it can be done if it is a small incisional hernia, it can be done as a day care procedure. So is there any new surgeries? There is a new surgery, ETEP, extended total extraperitoneal repair. That is a very good technique which is totally painless. So in this, the mesh is not kept inside or not outside, it is between the muscles you keep, makes it really absolutely painless surgery. So that is a new one. So as I previously said, what you should do, you go to a surgeon, you meet him, he will give you necessary investigations like blood investigations and ultrasound. Then he will advise you to do surgery. If he advises you to do surgery, please undergo surgery, because there is no medicine for incisional hernia. So this is what about incisional hernia is. Thank you for listening to my video. Please suggest my video to those people who need to see them, and you can please press the bell button to subscribe my channel so that you can get other videos. Thank you. Thanks.